N-word.
What's your name?
It's Jenny Lynn, if you want to know.
So TikTok removed my other stitch to this video, stating that I was violating community guidelines by using slurs. Mind you, I never called this girl anything. I never even cursed in that video. They said I was throwing slurs, and I was I was using my content to embarrass her. What she should have been embarrassed by is that video. She should have been embarrassed by herself. But nonetheless, I'm going to restitch it because this is something I'm actually passionate about. Healthcare disparities and the treatment of patients is something I'm actually passionate about. So I'm going to restitch it. Now I'm going to try my best to be careful with my words. Although I was very careful last time. I didn't call this girl anything. I'm going to try my best to be careful with my words. But my people, you know what I mean by my people? This is the reason. This is the main reason we have healthcare disparities in America. We have healthcare disparities because people like this are getting into these nursing and other healthcare professions. They're getting into these colleges, and they have these attitudes towards us, and it further worsens the healthcare disparities that we already have. Now, this is something I said in the other video, and I'm going to say it again because it's a hill that I'm willing to die on. It's something I'm very passionate about. Healthcare disparities is something I'm very passionate about, and this essentially is where it stems from attitudes like this. I don't want this attitude. I don't want this type of attitude anywhere in the healthcare field. I don't want it anywhere near any patients. I don't want it anywhere near my family who could possibly be a patient one day. I don't want it anywhere near any healthcare facility. I don't want it in any role, in any capacity in healthcare, whether it be a physician role, a nursing role, even I don't even want it in the housekeeping. I don't want it in dietary. I don't want it in social work. I don't want it in physical therapy, occupational therapy. I don't want any of that around any patients because it's very detrimental to the patient's health. And I say this because apparently this person is in a nursing program. I don't know where exactly. That's been something of confusion because what she says in the video is apparently a lie. But bottom line, this is something we do not need in healthcare.